the Male Fertility and Peyronie's Clinic. It specializes specifically just in Peyronie's disease and male infertility. I think the thing that sets the clinic apart is just the high volume that we see of these specific conditions. That ability to subspecialize allows us to get higher patient volumes, to focus on research, education, innovation, and overall to improve the quality of care. One of the key things we've tried to focus on from a clinic side is making sure that everything we do is evidence-based. So here, when we hired people, we said, look, we're all doing the exact same surgery, the exact same protocol, and then we're going to trace the data. If anyone starts to vary even a little bit, we then record their surgery, we scrub in, we check on them to see why are you varying, for good or bad. And what's neat about that approach is we found the variability in outcomes is only 2% at any given time among the providers. So it gives you much, much better standard of care where you know that no matter who I pick, I'm going to get the same type of outcome.
We have one of the largest databases on vasectomy reversals and Peyronie's disease in the world. Just keeping track of outcomes and see what's working, what's not, and be able to track that, go back in the data, and just always make sure we're doing what's best for the patient.
With vasectomy reversals, we do close to 1,000 or even sometimes more than 1,000 per year here. If it's a slight variation, whether it be due to like a certain amount of suture tension or the way that they're throwing the suture, then we can tell if that's providing us with higher success rates. I think we're one of the first clinics that has done a lot of these surgeries just under local anesthesia. It really benefits for patients, especially to where we have a lot of patients traveling from out of state. It's a quick recovery. They're able to fly home either day of or even the day after the procedure.
From an innovation standpoint, one of the things with male infertility is some new techniques as it relates to vasectomy reversals. And we found in one case vasectomy reversals would rip apart. And so we created something called the revast technique that provides a lot more redundant strength to the repair. We also found that with vasectomy reversals, sometimes they scar over. And we found that a drug called prednisone allows you to have a much better outcome long term.
Prednisone has been something that's been used for many, many years in vasectomy reversals, but there was no research into proper dosing or when or how long or when to give it. So doing the randomized clinical controlled trial combined with the database allowed us to figure out what's the optimal way to approach prednisone therapy after a vasectomy reversal.
With being able to actually introduce a low-dose prednisone protocol, what we've been able to establish is the actual sperm concentration is higher in those with the low-dose prednisone dosing. Also, what we have found is likely more detrimental are those who are in the high prednisone group. Those individuals tend to do worse when compared to high and low dosing of prednisone post-reversal.
Fertility in general is tricky because it's expensive, and couples are often at a stage in their life where they don't have a lot of money. So we decided to set that side of the practice at cost, where we don't make any profit on it. Because of that, it leads more people to come, which improves our outcomes, and it's just been a real wonderful situation overall. From a medical device standpoint, we've had a chance to innovate in a couple areas. We developed something called RestoreX. It's a traction device that addresses Peyronie's disease. We've also been able to develop something called RestoreXL that's a little bit more custom for men post-prostatectomy. And more recently, we developed something called Peyronie's gene, which is the first genetic test ever for Peyronie's disease, and it helps to better identify your risk factors for the condition as well as different subtypes that may happen over time.
Here we are like the first one being able to target this biomarker for Peyronie's and being able to tell you yes, how risky you are. We can prevent and give different courses of treatment before getting to surgery. This testing and studies can also develop new therapies, potentially gene therapies or other kind of therapies for targeting Peyronie's.
Trust. Nice to meet you. Thanks for taking the time.
So classifying Peyronie's disease has definitely evolved over the years. It used to just be that when we would see an individual, it was primarily identifying whether it was congenital in nature or if it was trauma-induced. And for us, we've been able to break it down into subtypes of the disorder, which really helps us narrow in on the most appropriate time to treat, but also type of treatment that's best, depending upon what classification they fit in.
Another area where we've been able to innovate relate to the technique of administration of a drug called XIAFLEX that have dramatically improved the outcomes to a point where we're almost 3 times better outcomes than when we initially started.
We follow up with our patients. We have a certain protocol with stretching using PDE5 inhibitors. We do a specific type of wrap that really helps mitigate the risk of swelling and bruising. And all of these small little nuanced things that we've been able to add to the aftercare that's really helped increase not only the efficacy of XIAFLEX, but the overall curvature reduction and overall patient satisfaction. Medicine is not stagnant, and it's continually changing, and hopefully someday we'll get this down to a science where Peyronie's care is more predictable and more efficacious.